Hi guys and welcome to my channel. Myself Dr. Akshay, and in today's session I'm going to be discussing about the topic vasodilator theory for acute blood flow regulation. If you guys want to learn more about the circulatory system, then click subscribe and the bell icon. So let's do this together. Coming to the topic vasodilator theory for acute blood flow regulation. According to this theory, greater the rate of metabolism, greater will be the formation of vasodilatory substances in some cells. Or in another way we can explain this theory as lesser the availability of oxygen and other nutrients, greater will be the rate of formation of vasodilatory substances in some cells. Vasodilatory substances will always diffuse through the tissues to the precapillary spinchters, meta-arterioles and arterioles to cause vasodilatory effect. So, vasodilatory substances are adenosine phosphate compound, carbon dioxide, lactic acid, potassium ions and hydrogen ions. So, when oxygen deficiency occurs in some tissues, these tissues will release vasodilatory substances. This release of vasodilatory substances will cause vasodilation and thereby causing the pooling of oxygen-rich blood into these tissues. Vasodilatory substances such as lactic acid, potassium ions, and carbon dioxide tend to increase in tissues when cell metabolism considerably becomes larger, or when blood flow to these tissues are decreased. This increase in concentration of vasodilatory metabolites causes vasodilation of these arterioles and thereby causing increased blood flow to these tissues. This helps in returning the concentration of metabolites towards normal. Minute quantities of adenosine are released from the cardiac muscles when coronary blood flow is too little. This release of adenosine from these cardiac muscle cells will cause local vasodilatory effect in these coronary blood vessels, thereby helping in increasing the blood circulation through these coronary arteries. When heart becomes more active than normal and when heart metabolism increases an extra amount, increased utilization of oxygen takes place. This increased utilization of oxygen in the heart muscle causes decrease in the concentration of oxygen. So, this decrease in concentration of oxygen along with the consequent degradation of adenosine triphosphate will cause the release of adenosine. And this adenosine is a vasodilatory substance. This release of adenosine will cause coronary vasodilation and increased blood flow towards his cardiac muscles. And this increased coronary blood flow is to supply the nutrient demands of the heart. So that covers the topic vasodilatory theory for acute blood flow regulation. I hope you guys learned about this particular topic. Thank you so much guys. Love you all guys. See you guys in the next session.